Hey everybody, Dr. Rob here, Facebook Live. New approach to diagnosing lower back pain. Do you have lower back pain? 8 out of 10 Americans have lower back pain. It is without question one of the most common ailments in America today. Lower back pain is the second reason, most common reason that people visit the doctor. So many people are confused about where to go and how to treat lower back pain. I want to talk about some new approaches to diagnosing lower back pain. One, I'm a chiropractor, so I'm a big proponent of always seeking out chiropractic with lower back pain. We are without question, as a field, trained to be able to give you the kind of outcomes that you want with lower back pain. But I really want to take it a couple of steps further and really show you some very interesting tools to enable your doctor, your practitioner, your chiropractor, your functional medicine doctor, your rehab specialist on tools to enable them to diagnose lower back pain. So one of the things that I found to be extraordinarily effective when it comes to diagnosing this lower back pain is blood labs. Blood labs will be very indicative of the presence, the approach, and the long-term presence of lower back pain. Let's look at some of these blood markers. These are all blood markers that your insurance covers. So this should be very easy for any of your doctors to be able to order them. Number one, C-reactive protein. C-reactive protein is an inflammatory marker in the tissue, in your human body tissue. It implies inflammation. It comes from your liver. There's many ways to decrease C-reactive protein. It is not a specific marker to any one ailment, but it is a general marker in that it is showing the severity of non-specific lower back pain. So C-reactive protein should be a standard. You even get those from your primary care physicians. Something to look at. They'll show for a presence of the severity of having non-specific lower back pain. In addition, something called interleukin-6. Interleukin is a form of cytokines. These are inflammatory markers to the cells. Cytokines, interleukins, hit the cell and they stimulate something that's called NF-kappa B. NF-kappa B is the signal transducer of inflammation. So C-reactive protein and interleukin-6 will show you again the severity of nonspecific lower back pain. Interleukin-6 was also studied. This was from the Spine Journal. Interleukin-6 was also studied last year in January of 2017 and shown to be indicative for lower back pain. So there's been 2 large studies done on interleukin-6. TNF, tumor necrosis factor alpha. Tumor necrosis factor alpha is interesting in that it will show you again the release of different kinds of cytokines. The presence of TNF alpha will show that you right now have the presence of nonspecific lower back pain. One is the severity. One will show you have the presence of nonspecific lower back pain. So there are blood markers to confirm something that I really like to tell everybody, that a musculoskeletal injury is not just a musculoskeletal injury. A musculoskeletal injury is an inflammatory injury that injures the body, the whole body. There's a direct correlation between blood inflammation and musculoskeletal injuries. So when you come to a doctor like me who speaks about the body from the inside out, what I'm saying is the way to fix musculoskeletal injuries is to have your manual rehab versus your nutritional biochemistry, to put them together to go down one specific funnel because they're intertwined with each other. So when you have a musculoskeletal injury and you can show it on these blood markers, you're really showing you have a systemic inflammatory condition, and you really need to elucidate this if you're a doctor to all your patients, and all the patients really need to know. I had 3 patients today that we spoke about that, and their number one thing was they want to be educated. People want to know what's going on with them, what this means for them, how they can get better. So when you speak about these things and you get more investigative, that's when patients really have those what we call aha moments. The third marker is Interleukin-1 Beta. This is actually expressed in degenerative disease. So a lot of people ask for correlations between X-ray and MRI. Interleukin-6 beta is a great choice to correlate that you've got some what we call extracellular matrix or cartilage damage, i.e. we're talking about disc injuries. So now we talked about 4 different blood markers in addition to any other diagnostic, orthopedic, neurological test that somebody may perform on you and you being a patient's symptomology. let's talk about some treatments, or what I found in 19 years of practice to help patients get better, faster, and stay better. Here we go. Number one, I'm a big proponent. Food is a potentiator for inflammation. So I'm a big proponent of an anti-inflammatory diet. What is included in an anti-inflammatory diet? Number one, no fried foods. Real simple. Avoid like trans fats. There's a multitude of diets out there that could fall under the concept of anti-inflammatory. You have your Mediterranean diet, you have your paleo diet, you have your ketogenic diet. Just follow these 3 rules. Rule number 1, no fried foods. Rule number 2, adhere to your GPS of health. No gluten, no processed food, no sugar. 74% of the sugar that you consume is in the foods in the supermarkets. So look at that label, and if you see has a label and it has all these hidden things, you probably have sugar in it. So no processed food, no sugar, no gluten, no fried food, and take care of your DNA. Avoid your dairy. I'll give you a little feta and goat cheese. No nicotine, no smoking. Smoking decreases blood flow, and it will decrease age, but decreases blood flow to your spine. You're not going to heal as quick. There must be at least 25 newer articles that speak about that. No nicotine, no chewing, no smoking, and the A in the DNA stands for no artificial sweeteners. As bad as sugar is, artificial sweeteners are even worse. They increase your incidence of dementia and stroke by 2 to 3 times. They damage your microbiome or your microbiota in your microbiome in your gut, damaging all your immune system, putting you down a cascade of musculoskeletal damage. So food is a potentiator from inflammation. Remember, if it comes from a plant, don't eat it. If it comes from a plant, eat it. If it's made in a plant, don't eat it. Did I say that right?
Yes.
I got it right this time. See, I always have those moments. Thank God for Joanne. Number 2, low-level laser therapy. Big proponent of low-level laser. Class 2 or less. Low-level laser. Everybody knows I'm an Aconia guy. I have 8 different lasers here. Low-level laser, 635, FDA cleared for a multitude of things. Low-level laser is one of my great choices to aid with lower back pain. It's based on Einstein's law of physics. 635 wavelength is the wavelength of visible light. Visible light has shown to have healing. Please search out low-level lasers or non-thermal lasers. Try to avoid those LEDs. They're heating. We don't want to heat an injured area. We want light, the healing of light. So for me, low-level laser is a great choice. It is my lead modality. In addition, core strengthening. Love to strengthen the core. So many people come in and have lower back pain and they don't strengthen the core. No sit-ups, no crunches, no leg raises, no knee-ins. Core should have a 360-degree co-contraction. You want to have this 360-degree co-contraction to stabilize and support your spinal cord. Remember, this shouldn't be moving. This should be sturdy. That's why planks, inside planks, and bird dogs are great examples of exercises to do and help rehab. Our core should move. Our periphery moves. The only time our core moves is when we twist our hips. Otherwise, our core should be stable, hold in place. A lot of people should do a lot of core work. We've got a lot of Mobility Mondays. Everybody should check it out. This Mobility Monday that's running was all about different core exercises. Great Chris Guerrero was helping me out, really doing a great demo on that. Most of my patients come in and they don't realize their need to strengthen their core. Everybody in here gets a core strengthening protocol and does core strengthening with me. And last but not least, what supplements do I recommend for lower back pain or the presence of lower back? So let's go through them. Number 1, SPMs, specialized pro-resolving mediators. They are fractionated fish oil. I strongly recommend them. They enable the resolution of inflammation. We need to not only manage and modulate inflammation, but we need the resolution of inflammation, or as I like to say, the homeostasis between the initiation and balance in inflammation. SPMs, you can get them from me if you need that. Just put a little, hey, where do I get them? And Joanne will be very happy to give you a link. SPMs are a choice because they resolve inflammation. In addition, low-level laser resolves inflammation. Number 2, AHCC, active hexose correlated compound. Not a lot of people use this. More and more should. It is a hidden gem on my shelf. I use it with so many of my patients. It is a derivative of the shiitake mushroom. It is great for immune function. And here's the key. It's the only thing I found that dims something called toll-like receptors 2 and 4. Toll-like receptors 2 and 4 are essentially the receptors on the inside of your intestinal tract that are released and stimulate this whole cascade of cytokines to NF-kappa B. So this blunts down toll-like receptors 2 and 4. Last week we talked about the vagus nerve stimulating inflammation in the gut if it was decreased. AHCC decreases those receptors, and I found it to be a valuable addition to my armamentarium in my office and to give to my patients. It is a shiitake mushroom, as I said, or derivatives of the shiitake mushroom. Really like using that, not talked enough in the literature. In addition, selective kinase response modulators and turmeric. Selective kinase response modulators are any type of herb that signals the cell. So what happens is when we take a drug stops the conversation in pathways, both healing and inflammatory. Whereas the selective kinase response modulators, an herb, they actually have the signal of health, and they actually block inside the cell a protein enzyme called a kinase not to allow the release of NF-kappa B. Probably the best selective kinase response modulators, or two of the best. Number one would be probably the gold medal winner, xanthocumol. Xanthocumol has been studied in 250 scientific journals and seen to have a multitude of health benefits. In addition, turmeric. Everybody knows turmeric. The active ingredient in turmeric is curcumin. Curcumin is that, that colorful the color to the turmeric. You want to always have a bioavailable form of curcumin. There are many different now available bioavailable forms of curcumin or turmeric, and those forms usually come from curcuminoid and fenugreek or have black pepper extracts added with it. And in fourth place, not in fourth place, but listed fourth, glucosamine and chondroitin. They are without question outstanding choices for anybody that has a disc injury. 2003, there was a study that showed that when you had a disc injury, and they used what we call objective markers, MRIs, they found that the disc got its water back because glucosamine has the ingredients and the properties needed to allow the disc to heal, and the chondroitin is this magnet of water to suck right back in and without question add to the cushiness of the disc. And lastly, I didn't put it up there, just a little quickie thing, just to give you guys a little thought process, modified citrus pectin. Modified citrus pectin is an overall body, without question, overall body detoxifier. A lot of information, going to do a big Facebook Live on it. I got all my stuff in. Do we have any shout outs, any questions, or anything like that?
No. You got a couple thumbs up.
I give you back a thumbs up. No questions? Okay, guys, great. So once again, new approaches to diagnosing lower back pain. C-reactive protein, interleukin-6 will be the severity of nonspecific lower back pain. Tumor necrosis factor alpha, the presence of nonspecific lower back pain. Interleukin beta is expressed in degenerative disc. Your treatments are your anti-inflammatory diet, DNA, no dairy, no nicotine, no artificial sweeteners, GPS, no gluten, no processed food, no sugar. Remember, food is a potentiator of inflammation. No fried foods. Low-level laser for about a 10-minute session. Make sure it's a true laser and not an LED. Love it. Resolution of inflammation, decreased pain, and increased range of motion. Core strengthening, critical element. The starting point is a 360-degree brace. And finally, supplements, SPMs, AHCC, skirms, turmeric, glucosamine and chondroitin, modified citrus pectin. Don't forget, we have our first webcast. We're getting a lot of good feedback. This Thursday, go check it out. If you like what you see, share it. Share this information with a friend. A lot of good information to use. Like, click, share, comment any information that you want. Dr. Rob, we are always doing every Tuesday live at 2 o'clock. We'll see you soon. Dr. Rob, always yours in health.